Hello, it's Dr. Ominde here. Just to wind up on the clinical relevance of the leg. So, number one, we talked about compartment syndrome, and we said that compartment syndrome is a constellation of symptoms that are caused by space-occupying lesion, whether bleeding or a tumor within a compartment. Remember, the compartments are formed by walls or boundaries that are yielding to pressure. The interosseous membrane, the fascia cruræ, the intermuscular septum, they are tight. So when you bleed within a compartment, when there's a tumor growing within a compartment, the boundaries, the walls do not accommodate, or rather are not able to expand. So the result leads to compression of the content. So when you compress the vessels, the distal portion of the limb becomes pale and you lose the pulse. So you have pallor and pulselessness. And when you compress the nerves, you have paresthesia, which is pins and needle sensation. You have pain and paralysis of the muscle. So that's how you get the 5 P's of compartment syndrome: pain, paresthesia, paralysis, pallor, and pulselessness. Then we also have calcaneal tendinitis. When the Achilles tendon is inflamed, you get calcaneal tendinitis, or the calcaneal bazaar around the calcaneal tendon insertion. When it's inflamed, you get calcaneal bursitis. We have foot drop. Okay, what is foot drop? When you have damage to the common peroneal nerve. Common peroneal usually it divides into deep peroneal to the anterior compartment muscles, causing dorsiflexion, and superficial peroneal in the lateral compartment, they cause eversion. Okay, so foot drop is injury to the common peroneal, can commonly occur at the fracture of the neck or fibula, and when you lose eversion and dorsiflexion because of common peroneal nerve injury, you get foot drop. Yeah, so remember your everters are in the lateral compartment, peroneus longus and brevis. Which muscles cause inversion? Inversion is when you make the plantar aspect of your foot to face medially. So inversion is mainly by tibialis anterior and tibialis posterior. Another clinical relevance of the leg, we have the muscle pump. What do we refer to as muscle pump? The triceps surae, the gastrocnemius and soleus, when they contract, they help, or rather enhance, the venous return. Remember, blood in veins of the leg, they're moving from distal. The blood has to be pumped upwards towards the heart, and you need valves to ensure that unidirectional flow of blood against gravity. So when these triceps surae, or the calf muscles, contract, they help to pump venous blood upwards. So this just shows you how the calf muscle pumps works. So this is your vein. So when the gastrocnemius contract, you can see you tend to push the blood that is in the vein will be pushed upwards. Okay. When they relax, this is how it is. When they contract, you tend to push the blood upwards. So that's the calf muscle pump. Now look at this. If you bring this in an exam, there's fracture at the neck of the fibula. So you get common peroneal, remember it winds around the neck, you get common peroneal nerve injury, and this will lead to foot drop because the deep peroneal nerve comes, and superficial peroneal nerve, which innervate dorsiflexus and everters, are going to be affected. Therefore, the person will not be able to dorsiflex and evert. So foot drop is characterized by slapping the foot, slapping the ground, because you're not able to dorsiflex. So this just shows you how foot drop occurs. On a normal foot, as you walk, this is what happens. As you lift the limb and you ask the patient to dorsiflex, that movement will occur on a normal foot. But when you have peroneal injury during foot drop, the patient is unable to lift the front part of the foot off the ground. So unable to dorsiflex. So when the patient is lying down, this is a normal foot, but this is the foot with foot drop. Okay, unable to dorsiflex. Thank you very much.